Welcome, everybody. Welcome to another episode of PEM Rules, the Pediatric Emergency Medicine Podcast. I'm your host, Yaron Ivan, as usual. And today we're going to continue our discussion of some very important clinical care tips. This is the category of About You, the Provider, Part 5. Rule number 76. An ER doctor never runs. Think while you're walking fast. I'd like to give a shout out to my friend Kevin Tomasic, who sits on the faculty with me on the emergency medicine faculty here in Orlando. He heard this rule, I believe, from his attending, Richard Serra. Never met the guy. I'm sure he's a great doctor. That's a very good rule. And I got to tell you guys, once I heard that rule, I thought it was really, really good. It makes a lot of sense to me. First, as the attending, I got to say, if I run in the emergency department, that's going to scare a lot of people. If the attending in charge is running, something really bad is probably going on. I can't even imagine how much anxiety that will generate around my nurses and my patients, and it's all going to be downhill from there. Clearly, if you need to run for a patient, something really bad is going on, and someone needs your attention urgently, and if you're running there, you're going to scare a lot of people that something really bad is going on. If you walk, however, not run, that changes the whole situation. Number one, when you walk, you can probably think ahead a little bit more clearly. Think about who is in that room. What was the patient's original chief complaint? Why you probably called there? What are you going to be doing when you get there? What are your next steps? Think about the ABC. What are you going to do if these fail? So you can think more clearly when you're just not running. Think while you walk fast. I think if you're running, thinking clearly is going to be a little bit more challenging. Being out of breath is certainly not going to help, and that's not going to serve anybody well. When you walk, you can think of your steps ahead of time. You can think about what you're going to do and why. What does that patient probably need? What are you called into the room for? What are you going to do if your steps or your interventions fail? And you can probably do a better job managing the situation. Again, not to mention that running is just going to generate a lot of anxiety among your nurses, your respiratory therapists, and your team. And that's probably not going to serve the patient well as well and going to make them less helpful for you. So rule number 76 says, an ER doctor never runs. Think while you're walking fast. Rule number 77. Residency and fellowship are not the time to save money. This is a rule I can probably best demonstrate by an example, and you know I like to do that. So this is a rule I thought about in medical school when I finally decided I'm definitely going to go into pediatrics, and I was about to face one of the pediatric exams, and I was strongly debating if I should buy Nelson textbooks of pediatrics. At that time, it was the 18th edition. This was a while ago. And I remember looking at the bookstore, and the book was well over $100. Needless to say, as a medical student with a lot of loans and 2 kids already, $100 was not an insignificant amount of money. And I decided not to buy the book because I didn't have the money. And I remember discussing this with a good friend of mine who simply said, you know, Yaron, I think that's a silly decision. You already acquired thousands of dollars in medical school debt. That debt is probably going to grow for all the loans you're going to continue to take. You decided to go into pediatrics. And this is the textbook of pediatrics. And this is a tool you can certainly use for many years. You're investing so much time and so much money in your education. $100 is a very, very small price to pay in order to better succeed on your exam, increase your knowledge, and doing what's right for your future career and your future patient. The more I thought about it, the more I thought it makes sense. So whatever tools you need in your medical school training, your residency and fellowship, it's probably a good idea to spend the money however you can get it and invest the money in those tools. You're investing thousands of dollars in your education. You're investing hundreds of hours in your education. What's another $100, $200, or $300 for a tool that will make your experience better, easier, and will help you do the right thing for your patients, and maybe even pass the exam on the first try? So rule number 77, residency and fellowship are not the time to save money. Rule number 78. Worry like a doctor, not like a parent. So this is a rule I thought about a few months ago during the COVID pandemic when I got a phone call from a primary care who was seeing a patient in his office. The patient is 2 months old male with no significant perinatal history. And I honestly don't remember all the details, but the doctor was very worried about COVID and said that the patient is being sent to the ER for concern of COVID. I always teach my residents and my medical students I accept 100% of the pediatrician's transfers. If they want to send a patient to the pediatric emergency department, the patient is always welcome, and I really appreciate them calling me in advance. The only thing I ask is before they send the patient is that they call me, and when they call me, I ask for the last set of vital signs. I encourage you as an ER physician to never accept any patients without the last set of vital signs. Back to the story. The patient was described to be doing well overall, but because of the age and because of the fever and because of some exposure to COVID, the patient is being sent. The primary care cannot check the child for COVID at the time, which is totally fine, and therefore send him to the pediatric emergency department. When the child arrived, he looked fine, and it made no sense to me that swabbing this child is going to be of any clinical significance. First, we know that most 2 months old with viral illness, including COVID, do very well. This is not a high-risk patient. Second of all, the patient had no respiratory distress, no hypoxia, and was feeding very well. I remember discussing the case with my resident and my medical student, and we reviewed what could be the worst-case scenario. I'm sure you know that the worst-case scenario would be an SBI, serious bacterial illness, which is still out there, unfortunately, significantly reduced due to the use of vaccine. That patient already was vaccinated for his 2-month shots, which was great, but we have one SBI with no vaccine out there, and it is the most common SBI. We call it urinary tract infection, and it exists in about 3 to 5 or 6% of patients, newborns with fever. That is a serious infection, and that is an infection that if you don't get antibiotics as a 2-month-old, you can get into some serious problems, unlike COVID. While I certainly appreciate that the primary care was worried about COVID, I think the primary care was worried like a parent. Parents worry about COVID, which I completely understand with everything that is going on, but parents don't really know maybe that a 2-month-old with COVID does very well. A 2-month-old with UTI, not necessarily. While I understand and appreciate the concern for COVID, I think as a pediatrician and as a primary care physician and as a pediatric emergency doctor, you need to worry like a doctor, not like a parent. So this patient needed the urine analysis, which unfortunately was positive, and he did go home with antibiotics. This is just an example that as a physician, as a pediatric emergency doctor, you should worry like a doctor, not like a parent. Worry about the serious infections or the possible serious outcome. I don't believe a viral illness, COVID included, is a serious infection for a 2-month-old who is clinically well. But a UTI, being an SBI, could be very problematic unless treated. So rule number 78, worry like a doctor, not like a parent. Another example is a few months ago, I got a phone call from a primary care who described the patient they want to send to the ER. As usual, I always accept the patient. I just ask for some details and the last set of vitals. And the story goes that a few days ago, the patient fell on his head, has been having a headache since, and the primary care would like to send the patient to the ER for concussion. Again, I think that's another example where the primary care was worried like a parent, not like a doctor. So I'm not sure why, but concussion just has a horrible reputation. It is a benign diagnosis, and it is a diagnosis that goes away. It's not something that I consider serious, certainly not life-threatening. And while I understand why parents and coaches are worried about it, because repeated concussions can get you into some troubles, I think that primary care was worried like a parent about concussion. And I think he failed to think, what can I, the pediatric emergency doctor, do for concussion? As far as I know, there is no treatment for it. There's no test for it. It's a clinical diagnosis, which the primary care already made successfully. And I can't see the benefit of this patient being in the emergency department. It's already been a few days. Other than a headache, the child is fine. His symptoms can be well controlled with oral analgesia. And I do not see the reason or the benefit of sending this patient to the ER. Certainly, I accepted the patient, I spoke to the parents when they arrived, and sent the child home. But I think that physician was worried like a parent about concussion. As a physician, you should maybe worry about serious head injury, be it a skull fracture or a subdural, which is very unlikely in a well-appearing child 3 days after the injury or several days after the injury. And I think it's important to keep in mind that in the pediatric emergency department, I cannot make the diagnosis of a concussion better than any primary care. I have no test for it, and if it's been 2 days, it's all about the clinical picture. That child's clinical picture was still normal. So rule number 78, worry like a doctor, not like a parent. And that is it for today, guys. Thank you very much for listening. I hope you tune in the future. Let's review what we learned today. Rule number 76, an ER doctor never runs. Think while you're walking fast. Rule number 77, residency and fellowship are not the time to save money. Whatever tools you need for your education, invest in them. Rule number 78, worry like a doctor, not like a parent. Think about the worst case scenario from your perspective and rule it out. And that is it for today, guys. Thanks again for listening. Please check out pemrules.com. Submit any feedback. If you have any requests for future topics for episodes, I would love to hear from you. Have a great day.